I'm Dr. Ejaz Husain with the Associated Ophthalmologists. We have a group practice in Des Moines, Iowa. I have been in practice for the last 14 years, and we have been offering premium IOLs since 2005. Since we've done multifocal lenses for some time, we've been lucky enough to have a pretty good experience with different lenses. And one of the things that was important to me as a surgeon was to find a lens that would best fit the patient's needs and that the patients would not be complaining about certain factors about the lens. I started with some other lenses, but patients had problems with reading in dim light. Therefore, I looked at the TECNIS multifocal lens. As far as our experience is concerned, I realized earlier on that the only way that I could have my practice personnel, my technicians, and people who work with me sort of buy into this technology was if they really saw results from patients. And so it was the burden on my shoulders to make sure that those patients would have superb results. Once the technicians started working with postoperative patients and realized that these people were very happy with the lens, the confidence was very easy to pick up, and patients picked up on that.
I think the biggest impact is, look at me, I'm 72 years old and I don't wear glasses. I read the newspaper, I watch television, I drive at night, there's no halos, I play golf, I can see the golf ball, whereas before I had difficulty following the golf ball. And now I don't have that. And the guys I play golf with are amazed with what's happening.
One of the issues that we had was with all the marketing that goes on with multifocal implants from the various different manufacturers. It was difficult for me to find out exactly which would be the best lens for my patient. One of the things that I noticed was I started sending surveys to my patients postoperatively at 3 months and at 6 months, and I would send the same survey to patients who had a different multifocal, and we started getting those answers back. And we noticed by comparing the surveys that the level of satisfaction with the TECNIS multifocal lens was indeed extremely high, and so that kind of made us use this lens more than any other multifocal lens at this stage. I think the critical thing to do is to be very honest with your patient. You have to sort of partner with them. After all, it is their eyes that you're working on. So it's important to listen to what the patient says and understand what their expectations are. Now, I get very enthusiastic when I'm talking about the TECNIS multifocal lens because I feel comfortable with the results. But I have to balance that enthusiasm with the patient's expectations. So I tell my patients, remember, this is a man-made lens. It is not perfect. You are not going to have perfect vision, but it's going to be the best vision you've had for distance, near, and intermediate. I also tell them that this lens has some shortcomings. All multifocal lenses have a decrease in modular transfer function, so the contrast decreases a little bit. That hasn't been much of a problem for us because patients with cataracts already have a decreased contrast. But the glare and halos that the patients might notice at night is something you need to educate them preoperatively. So I tell my patients the following. I tell them, at night when you drive, you're going to notice some glare and halos. This is going to get better with time. Every multifocal lens has this, and it's happening because you have two images. And so you will filter out the noise and you will adapt. And we all know that neuroadaptation and neuroplasticity helps with this process. So at 6 months, when we got our surveys back, the glare and halo issue didn't exist. Actually, even at 3 months, there was no significant complaints. And I think the reason is, I believe the glare and halo is there. Patients get used to it very quickly. And because they know about it preoperatively, they tend to worry about it much less.
Equal 0-calorie sweetener, sweet as 2 teaspoons of sugar. Nutrition facts, serving size, 1 packet.
I do experience a little bit of a halo at night. I remember right after the surgery. I remember the doctor asking me before the surgery if I had halos, and I thought, I don't think so. And then right after the surgery, there were definitely halos, and I thought, okay, now I know what they mean when they say halos. But he assured me that it would kind of subside over time, and it definitely has. There is a little bit of a halo now, but it's not something that I notice. I just kind of have become accustomed to it, and it's not something that bothers me when I'm driving.
The interesting thing that we found out from our surveys and from talking to many, many patients was that the TECNIS multifocal implant is the first implant that I have used that has been sort of a forgiving lens. If I'm not exactly at plano, if I'm a little bit on the myopic side, let's say a -0.5 or a +0.5, or if I have a little bit of astigmatism residually left, the patients tolerate that extremely well. And we actually refracted all these patients to try to give them the best refraction, and they actually preferred their vision with these small myopic and hyperopic changes without glasses. I remember when we first started doing multifocals, we were very careful in who we would recommend the lens to. And now, because of the TECNIS multifocal lens, we have very little hesitation, and we basically recommend it to almost every patient who meets our criteria.